As we celebrate the World Patient Safety Day, and by espousing the theme you just mentioned, specifically health worker safety, priority for patient safety, we highlight the importance of promoting the safety of our healthcare workers as an integral part of our patient safety initiatives, and therefore creating a culture of safety that encompasses all hospital systems.
Right.
It was overwhelmingly well attended,
Right.
and I'm so proud of it.
Right. Right.
And the keywords speak up from the WHO. We highly encourage our staff to speak up, meaning to report to any concern, any safety issues without fear of reprisal. We encourage them to report near misses, you know, because by reporting the near misses, we are able to analyze the data, aggregate and analyze the data, and eventually, have a higher chance of preventing them from occurring in the future. Another way of encouraging them to speak up is by doing that leadership safety walk around. There's nothing like us leaders, going down to the front lines and actually hearing them out and getting back to them with the feedback, trying to address their safety issues, staff issues. There are several other issues that we have uncovered during these leadership safety walkarounds that we were able to address. Even my immediate superior, the president and CEO, is always pleased to join us. We have a very strong leadership support in our organization, and that's, I think, one of the critical components in establishing a strong culture of safety. Having a business continuity plan, for example, in the event of not only COVID-19, but any other globally communicable diseases, would be very, very helpful because they
Mm.
pointed out they pointed it out to us as one of the requirements that we need to improve on actually
I see.
in
Very
2019.
interesting. Oh,
And
just
just
last
in
year.
time for the 2020, we were able to focus and strengthen that program. Then
Right.
boom, the pandemic
Right.
hit us. And we realized, wow, good thing we have a plan.
Right.
We provided them with transportation. And for those who do not feel safe to go back to their families, we provide boarding and accommodation here in the hospital.
Right.
And we also ensure that, and I think this is very important for the staff, that we always have available quality PPEs or personal protective equipment for them. For them, that is very important, especially during the pandemic when, resources were really, really difficult to procure, especially the PPEs.
Right.
But we made sure during that time and up until now that we have available quality masks and other PPEs available for them to use, for them to feel safe.
Right.
We were able to anticipate. At the beginning of the pandemic, we started working on our dashboards where we are able to somehow, analyze the patterns and the trends. Data is very important. We are able to analyze the data and we are able to anticipate the need for the equipment, the critical drugs that is needed for the pandemic, the staffing, and all that. So I think having a dashboard is also very critical in order to guide the management, right? To give them a more informed decision on where to invest. We advocate for what we call value healthcare or value management, okay? That is better outcomes at a lower cost. If there's one thing that we've learned is that um, promoting patient safety has a lot to do with collaboration as well. So working collaboratively, multidisciplinary, not only amongst nurses, amongst doctors, but collaboratively, doctor, nurse, pharmacy working together to improve medication safety is really a key to promoting.
Right. So from how you describe your patient safety team and champions, I think they are all frontliners, no less, in this fight against
Totally agree.
COVID.
Totally agree.
Yeah.